Bismillahirrahmanirrahim. Assalamu alaikum. Good morning. Bonjour. Buenos días. Chers consoeurs, chers confrères, j'espère que tout se passe bien chez vous et chez vos proches. D'abord, je vous souhaite la bienvenue à ce premier congrès international à distance de médecine légale organisé par la Société marocaine de médecine légale le 19 et 20 juin 2020 en collaboration avec le Comité international de la Croix-Rouge, CICR. Le thème choisi pour ce congrès international virtuel est médecine légale et Covid-19. La pandémie du Covid-19 représente une grande crise sanitaire mondiale posant de nombreux défis à tous les pays du monde sur le plan sanitaire, social, économique et politique. À ce jour, plusieurs zones d'ombre existent concernant le nouveau coronavirus SARS-CoV-2. Ce nouveau virus n'a pas révélé tous ses secrets. Notre spécialité, la médecine légale, à l'instar d'autres spécialités médicales et chirurgicales, la médecine légale contribue à apporter des éléments importants à la compréhension de la physiopathologie de la maladie. En effet, l'examen post-mortem des corps des personnes ayant succombé suite à une infection par ce virus, cet examen post-mortem peut fournir des informations primordiales et permettre de mieux connaître le mode d'action du virus, mais aussi de combattre ce virus en améliorant la thérapie des patients. Je remercie tous les conférenciers qui ont répondu favorablement à notre invitation et tous les participants à cette manifestation scientifique internationale inédite. Ces experts qui nous ont honorés par leur participation à ce premier congrès virtuel appartiennent aux différents continents, Afrique, Europe, Amérique du Nord, Amérique latine et Asie. Ces experts vont mettre en évidence le rôle de la médecine légale dans la prévention et la lutte contre cette pandémie internationale, ainsi que les dernières nouveautés scientifiques concernant le Covid-19. Ce congrès international virtuel nous éclairera sur les actualités des recommandations pour la gestion des décès, sur les principales données des autopsies scientifiques effectuées sur les cadavres Covid-19 et aussi sur les aspects éthiques liés à la lutte contre cette pandémie. Le programme de ce premier congrès international à distance sera comme suit. Aujourd'hui, nous aurons 3 sessions qui seront animées par 23 conférenciers. La première session sera en anglais et aura lieu de 13h à 15h. Toujours, c'est l'horaire marocain, c'est-à-dire GMT+1. Cette première session en anglais sera modérée par mon ami professeur Samir Nia, professeur de médecine légale, faculté de médecine de Tanger. La deuxième session sera en français et aura lieu de 16h à 19h, toujours GMT+1. Cette deuxième session en français sera modérée par professeur Hicham Beniaïs, chef de service de médecine légale CHU Ibn Rushd de Casablanca. La troisième session sera en espagnol et en arabe et aura lieu de 20h à 22h, toujours c'est l'horaire marocain, c'est-à-dire GMT+1. Cette troisième session sera modérée par moi-même, professeur Ahmed Belhous, président de la Société marocaine de médecine légale. Demain, samedi, nous aurons rendez-vous avec 3 sessions webinaires qui seront animées par 13 conférenciers. La première session webinaire sera en anglais et aura lieu demain de 12h à 14h, toujours horaire marocain, GMT+1. La deuxième session webinaire sera en anglais et aura lieu demain de 14h30 à 16h30, GMT+1. Et la troisième session sera en français et se tiendra de 17h à 19h, toujours GMT+1. J'espère que ce premier congrès virtuel de médecine légale et Covid-19 permettra un riche échange d'actualités sur la maladie Covid-19. Chers collègues, au nom de la Société marocaine de médecine légale, je vous remercie encore une fois d'avoir répondu à notre invitation. Je remercie également le CSR pour sa contribution à l'organisation de cette manifestation scientifique importante. Nous sommes tous fiers et honorés par ce congrès innovant, plein d'expériences diverses et porteur d'une énergie sans faille dans toutes les composantes de notre profesión. Para nosotros, amigos de España y Latinoamérica, bienvenido a este congreso. El programa del congreso es el siguiente. Tendremos 2 días. El primer día, hoy, está dedicado a conferencias grabadas. Tendremos 23 conferencias. El segundo día, mañana sábado, estará reservado para sesiones de webinar. Tendremos 3 sesiones de webinar, séminarios web. Sans tarder, je cède la parole à mon ami professeur Nia Samir pour modérer la première séance de ce congrès et je vous remercie.
Thank you, Professor Belhous. Welcome to the first session of our first International Virtual Congress of Forensic Medicine. The first intervention will be made by Professor Jorge González Fernandez, the Director of Legal Medicine and Forensic Science Institute of La Rioja of Spain, who will speak about COVID-19 pathological study and biosafety recommendation. So to start, Professor Jorge, I am giving you the lead.
Hello, good morning. This is Jorge González. I'm a Spanish forensic doctor. I work as a director of Legal Medicine Institute in La Rioja, Spain, a small region in the north of Spain. And I want to appreciate the organization of this virtual congress for inviting me to give this presentation. I'm going to speak about the pathological study and biosafety recommendations. And I'm going to do a small introduction. The coronavirus are the largest of the RNA virus, and they have a special characteristic morphology with spicures. We are going to see some spicures, some spike in some image later. The disease is transmitted mainly by respiratory secretions in person-to-person contact, but deposit on the ground and surfaces either can transmit the infection. The organ, the target organ is the lung. It has been considered the target of this infection, but the recent reports has discovered that there are some organs can be affected by the coronavirus. In the second part, we are going to review the main reports published about autopsy findings in people dead because of the coronavirus. The first one is a case in Spain, the first case known in Spain. It took place in Valencia, in the Mediterranean coast, and we can see a congestive appearance in the lung. And the study through the microscopy permit to see an hemorrhagic edema and hyaline membranes. Here in the second image, we can see a thrombosis, and here we can see mono and multinuclear cells. This is the report about people dead in Oklahoma. Is one of the first reports from the United States, and we can see a diffuse alveolar damage in an acute stage. Here we can see the air spaces are filled by a mix of neutrophils and histiocytes, also in an acute bronchopneumonia. Here we can see a patchy interstitial chronic inflammation. The next one is our report from New Orleans, and we can see an extreme right ventricular dilatation with a strengthening of the interventricular septum. We can see a bilateral pulmonary edema and patches of dark hemorrhage. And here we can see thrombi present within peripheral small vessels. the same report. Through the microscopy, we can see an extensive extracellular fibrin deposit. And we can see here cardiac myocytes with focal degeneration. A report from China about cases by minimally invasive autopsies. We can see cardiomyocyte hypertrophy, degeneration and necrosis of some cardiomyocytes. And here we can see swelling and dissolution of myocardial fibers. Here are hepatocellular degeneration, focal necrosis, and gall plugs in small bile ducts. And at least we can see in kidney, transparent thrombus was seen in the capillaries in this organ. The same report through the electron microscope permit to see various particles in the lung type 2 epithelial cells with its distinctive spikes. Next report about findings on venous thromboembolism in patients with COVID-19. It took place about 12 patients. All of them had RNA SARS-CoV-2 in lungs, 9 in throat, 6 in blood, and 5 in other tissues, heart, liver, kidney, and brain. Here we can see a pulmonary embolism took place in 4 cases, and it was the cause of the death. Here we can see a deep venous thrombosis. It appears in 3 cases. And here we can see a thrombosis of the prostatic vein appeared in 6 over 9 patients. Through the microscope, the same study, we can see a diffuse alveolar damage with hyaline membranes. Here we can see also the hyaline membranes. And here we can see a pulmonary embolism in the last picture on the heart. We can see mononuclear infiltrations consisting in lymphocytes and myocardium of the right ventricle. A report about the damage on kidneys permit to see the vascular degeneration with debris composite of necrotic epithelium in tubular lamens. Here, and here. And erythrocyte aggregates obstructing peritubular capillaries were frequently present. Here, and here. And the last images are coronavirus particles with distinctive spikes were present in cytoplasm of the proximal and distal tubular epithelium. The next one is a report published in The Lancet about endothelial cell infection. And in the first and in the second image, we can see viral inclusion structures in endothelial kidney cells. In the third image, we can see accumulation of inflammatory cells associated with endothelium, as well as apoptotic bodies in the heart and in the small bowel. The last one, the last image, permit to see accumulation of mononuclear cell walls found in the lung, and most small lung vessels appear congested. The last one is a very important report published on 22nd of May about 67 cases from the Mount Sinai Hospital in New York. And we can see several tissues and how the coronavirus affected these tissues. On the first image, we can see a diffuse alveolar damage in the acute oxidative or proliferative, early proliferative phase. In the second image, we can see a thrombi in medium-sized arteries. It appears also in arterioles and capillaries in 23 over 25 cases studied. The third image reveals the presence of multiple spherical virus particles showing spike. The spikes are not so clear as the last image we saw several minutes ago. And the fourth image permits to see a epicardial mononuclear infiltrate. And also here we can observe a small vessel thrombi. The last images are about bone marrow tissue, and it permits to see hemophagocytosis identified in these images. And now we are going to review the main recommendations of the principal international guidelines. The provisional guidelines on autopsy practice for deaths associated with COVID-19 for the Society of Pathological Doctors in China. They combining their requirements for biological safety. Autopsies work should be carried out as soon as possible after the patient death. They recommend 12 hours after death, and it differs respect our countries. And the autopsy, they recommend the autopsy must do in a biological safe room with negative pressure, and if it's impossible, it's necessary to make a disposable protective bag or in a device specially designed for the autopsy of infectious diseases. This is the picture who appeared in this guideline. About the personal protection and support for the autopsy, they tell us the number of people participating in the autopsy is limited to 5 people, different respect our countries. And about for the craniotomy operation is recommended to use positive pressure protection equipment. And obviously, during the autopsy, it's necessary to avoid splashes of blood, body fluids, urine, and corpse faces on the anatomical table and anatomist clothing. So use, but it's necessary to recommend. And about the general principles of autopsy, it's necessary all organs are systematically and thoroughly inspected one by one according to autopsy procedures. It's also different respect our countries. The autopsy should be carried out in a transparent and safe leak-proof autopsy bag. We saw this kind of bag 2 slides before. And the use of a power saw to open the skull or open the coffin is not recommended. About the collection of samples, it's necessary to take lung tissue, trachea, and bronchi, as well as fluid samples such as a pleural fluid. This is the guideline of the Royal College of Pathologists in the United Kingdom, and they tell us it's necessary that around 6 hours should be used. The sharps in the working area should be kept to a minimum, and their whereabouts known at all times. And the only one every time must to operate in the body cavity, and the use of an oscillator saw with suction extraction of the bone marrow into a removal chamber should be used for showing the skull. The College of American Pathologists published this amendment of their guideline on 5th of May, and they recommend the autopsies must be performed in a room with control recommendations set for by the CDC. It's each site performing autopsies to determine if and how it will open the head and remove the brain for evaluation. About the autopsy personnel, the minimal number of personnel necessary to safely and competently perform the procedure. All personnel present during a COVID-19 autopsy should be recorded, and the observers and students should not participate in autopsies of infected and potentially contagious descendants. In Spain, it has been published recently a monographic number of the Spanish legal medicine magazine. And we said it's necessary to review the guidelines for action regarding global management that includes the organization and management of diseased persons in cases of pandemic. The corpse collection and management centers must be located in facilities equipped with areas for rest and isolation of personnel, and that allow the installation of refrigerated spaces. The Spanish Society of Forensic Pathologists distinguished between some kinds of bodies. They gave some rules for the autopsy. The lungs will not be removed and manipulation will be avoided as much as possible. Extraction of viscera and their manipulation will be limited, except for cardiac viscera. Sampling for histopathological study will be limited, and the number of people who will perform the autopsy should be reduced to the essential minimum. And the last recommendations are from the Spanish Forensic Council, and we recommend to minimize the manipulation and transportation of the bodies subjected to a judicial investigation. We also recommend that each forensic institute here in Spain prepare its own internal instructions document. And at the end, the last recommendations are resume of these recommendations. Practice autopsies safely. Only one physician and one assistant in every autopsy. It's necessary the protection and PPE. Do microscopic studies to know the effects on the body. Don't remove organs because they contain viruses. And follow guides and protocols. Thank you very much.
Thank you, Professor Jorge González Fernández. The second speech presentation will be presented by Dr. Hind Abu Zahir, who will talk about Morocco's forensic field in the time of COVID-19 is the title of the second presentation. It will be done by Hind Abu Zahir, doctor at Institute of Legal Medicine of Casablanca, Morocco.
Ladies and gentlemen, welcome to our International Virtual Congress of Forensic Medicine. My name is Hind Abu Zahir. I'm a forensic resident doctor at Casablanca Medical Legal Institute. It's really an honor to be here with all of you without exception, and your presence means a lot to us. So today, I'm going to talk about forensic in the time of the new coronavirus, especially in our country. Why this is important? Because this pandemic is truly a global health threat, and it is considered as a further challenge for the forensic community to respond adequately to high caseload and fatalities caused by COVID-19. So first of all, I'd like to remind you that history has taught us how new pathogens emerge randomly and cause outbreaks with a global impact and million deaths around the world. Since then, the world has not seen a public health emergency of that scale. In spite the fact that the West African Ebola outbreak in 2014 was an evidence that the planet remains vulnerable and we are not aware of when and where the next global pandemic will arise. That experience battling Ebola helped some African countries prepared for COVID-19. So this year, 2020, marked the appearance of the new coronavirus, which also called COVID-19. On January the 12th, 2020, the World Health Organization confirmed that a new coronavirus was the cause of a respiratory illness in a cluster of people in Wuhan city of China, which was reported to the Health Organization on December 31st, 2019. This disease is caused by a serious acute respiratory syndrome, coronavirus 2, SARS-CoV-2, and it was spreading globally at a fast rate over the continents. The transmission has been significantly greater with a significant death toll. So following this rapid expansion, the World Health Organization declared COVID-19 as a world pandemic on March 11, stating that we need to test, trace, isolate, and treat. So starting from China, the mainland of COVID-19, and according to what has been published as statistic up until now, over 4,634 died from COVID-19, with 83,181 total confirmed cases. The case fatality rate was 5.6%. Speaking about the wide transmission and passing by Europe, the number of confirmed cases become greater than those in China. The World Health Organization considered Europe as an active center of COVID-19 pandemic, with case fatality rate of 8.5%, which means 180,044 death cases out of 2,123,724 total confirmed cases. Still speaking about the wide transmission, while going through the United States, that had the most confirmed active and death cases in the world, with case fatality rate of 5.5%, which means 117,427 death cases out of 2,135,410 total confirmed cases. Arriving at Africa, the COVID-19 pandemic was confirmed to have spread to Africa on February 14. The first confirmed cases was in Egypt and Nigeria. Most of the identified imported cases have arrived from Europe and the United States rather than from China. And in less than 3 months, COVID-19 outbreak has now affected over 60% of African countries, with case fatality rate of 2.7%, which means 6,524 death cases out of 242,969 total confirmed cases. Here we go, back to Morocco. The COVID-19 pandemic was confirmed to have spread in our country on March the 2nd, when the 2 first cases of COVID-19 were confirmed in Casablanca, city of Morocco, which involved 2 Moroccans coming from Italy. The case fatality rate of COVID-19 in Morocco has decreased over the past few days to stand at 2.4%, which means 212 death cases out of 8,838 total confirmed cases, compared to the case fatality rate of the virus in the worldwide, which is 5.5%. So how our country responded to this crisis? Let's go and see. In a global way, many preventive measures have been implemented by Moroccan government at an early stage, starting from temperature measurement, isolation of passengers, and also travel restrictions, flight and events closures, border closures, and then declaring a medical emergency state with school closures. Other procedures were taken, such as direct 24-hour hotline to communicate with citizens about this disease, as well as informing about suspected cases. Also, obligation to wear face masks in public. Besides, Morocco's COVID-19 testing capacity reached over 17,500 tests a day with the help of 24 national laboratories. Moreover, on May 20, the Ministry of Health had launched a campaign of mass COVID-19 testing in all regions to detect possible suspected cases, in addition of mobile application Wikayatina for COVID-19 tracking to notify and manage people who encountered confirmed cases more quickly and to limit transmission of the virus. Also, the Technical and Scientific Committee of the Ministry of Health used chloroquine in therapeutic protocol to treat patients with COVID-19 infection. Now that you are aware of the overview of Morocco's situation, let's go and look at how Moroccan forensic community has responded to COVID-19 pandemic. My first point will cover the recommendation of the Moroccan Forensic Society. Mainly, it has prepared a guidance to advise on the management of the dead bodies from COVID-19 infection, as well as COVID-19 fatalities management in mortuary. The second point will cover Casablanca Forensic Institute's practice during this health crisis. So let me briefly summarize the main points of each one. As you can see, regarding dealing with probable or confirmed death cases with COVID-19, our Forensic Society recommended the following. First of all, preparing a team well equipped with necessary protective equipment. This team is trained in how to deal with dead body with COVID-19 infection. Also, in how to communicate with the family and relatives of the deceased. Secondly, preparing the body of the deceased, and it depends on which the situation we are in. You can see that the first situation is when a person died in one of the hospital departments and with confirmed COVID-19 infection. In this case, the body will be prepared for the ritual burial operation in the place where the death occurred to limit the transmission. The preparation will be managed by 2 people from the trained team equipped one. Then, the body of the deceased will not be washed. The natural airways will be closed. Then the team will put the body in a sealed bag. The external surfaces of this bag will be sterilized using an antiseptic product. The family of the deceased will be instructed to not touch the body nor approach it more than 2 meters over the list. After that, the body in the sealed bag will be moved to closed coffin. Finally, the coffin will be transported by specific ambulance directly to the selected cemetery without passing through the died warehouse nor the home funeral, according to the Moroccan Decree number 68/986 of October 31st, 1969. What's more, at the end of each burial ritual operation, everything related to the burial operation should be sanitized, including the room where preparation took place, as well as the transport vehicle. Now, I'd like to move on to the second situation, when the hospital received a died person suspected of carrying COVID-19 infection or death occurred before admission and we don't know if that person carried the virus or not. In this case, a post-mortem nasopharyngeal swab specimen for COVID-19 testing will be performed, and if it is positive result, the body will be handled the same way as described in the first situation. If the died person is an unknown person, in order to be recognized by a relative, the permitted distance should be at least no more than 2 meters. In case of abnormal death, suspicious death, COVID-19 testing will be performed, and it is left to the prosecutor to consider the necessity of performing an autopsy or not. Therefore, if no natural suspected death and an autopsy was ordered by the prosecutor to clarify the manner and the cause of death, the autopsy will be performed by the forensic doctor, like usually, respecting protective measures and according to what hospital could provide as materials to prevent infection transmission in case of positive COVID-19. Passing to the second point, as you can see, in less than 3 months during COVID-19 pandemic, full medico-legal autopsies were not being performed except for extreme circumstances. For many reasons, mainly the fact that the system is generally under pressure. We received during this pandemic many cases of sudden death that occurred before admission to hospital, which we performed post-mortem nasopharyngeal swab, and it was negative results. I'd just like to mention that scientific autopsy of the death cases with confirmed COVID-19 were not allowed by justice system, and we didn't receive any official permission nor approval in our context for that reason. So in order to continue performing medico-legal examination and bodily damages assessment of the living during this lockdown, our Medico-Legal Institute reorganized adequately the examination rooms while respecting the protective measures and the distance between each victim, and so that to manage correctly the numbers of the victims and to ensure everyone's safety. Here we go, arriving at the end of my speech. And to conclude, forensic medicine and science in most societies are perceived as of paramount importance for the assistance of the justice as well as the safeguard of human rights. We should not forget that all worst things must come to an end, including this health crisis, which it will provide the forensic community with new experience and knowledge. For this prolonged medical emergency state, it is a little bit too early to sum up what effect this crisis will truly have on forensics. So whatever the situation is, whatever comes next, we'll always, always, always keep our excellent performance. So I sincerely appreciate your attention today. Thank you very much for joining me, and stay tuned to see more of our virtual Congress. So thank you very much.
Thank you, Dr. Abu Zahir. Arriving at the third presentation made by Dr. Bilal Sablouh, Regional Forensic Coordinator of Regional Delegation ACRC, who will speak about the importance of the ECRC environment in management of the AIDS response in West and North Africa.
Good day. First, I would like to thank the organizers, speakers, participants, and everyone who contributed to the success of this conference. The title of this presentation, The Importance of the ICRC Involvement in Management of the Dead Response in West and North Africa. My name is Bilal Sablouh. I am the ICRC Regional Forensic Coordinator based in Tunis Regional Delegation. I cover countries in West and North Africa. I am a specialist in forensic medicine. So the objectives: promote and reinforce the forensic humanitarian actions and ensure to include the forensic humanitarian response in the general forensic response in each context and each country. Determination of the different responders involved in the management of the death, and provide practical recommendation for non-specialists, including gathering basic information. Here we mean not only the forensic and forensic medical specialists and doctors, but also the first responders and the emergency responders involved in different stages of the management of the death. Understand the different existing methods in each context used in the identification process and maximize the identification of recovered dead bodies. Try to find solution to the divergences of the approach between different countries, and develop and suggest a mechanism that correspond to each context, taking into consideration the existence and the lack of different forensic medical discipline between the countries. Minimize the suffering of the bereaved people by providing the necessary support, answers, and clarification to the family of the deceased person. The aim: ensure a dignified management and treatment of dead bodies and a safe, dignified burial. Respect the traceability, ensure a correct and proper management of the death, proper and correct collection of antemortem data and postmortem data, proper burial of the dead bodies, and be able to find the graves and the dead bodies in case the family asks the repatriation or the fate of their beloved. Support and show respect for the bereaved people, especially provide them with all the necessary answers and all the necessary support that they request. Realistically take logistical and human constraint into account, especially in the difference in the development of the forensic medical discipline between different countries and the existence of different material and human resources between the different countries. Ensure the traceability and identification of bodies as efficiently and effectively as possible, and prepare the ground for the next steps. The major subjects, so the region of West Africa and the region of North Africa. First, there is migration. So those countries, some of them is country of origin, the others country of transit, and the others country of destination. So the importance here is to find a mechanism of coordination and cooperation between those countries in the management of the dead bodies of the deceased migrant, to try to maximize the identification of the recovered dead bodies, including a mechanism of the management of the lost dead bodies, especially in the deserts and in the sea, and a mechanism to communicate with the families. Some countries of West Africa, there's ongoing armed conflict, so with all the challenges during the recovery, storage, examination of dead bodies, communication with the family, and the transfer of human remains. Recently, the COVID-19 spread and the management of the COVID-19 related deaths. Challenges. So unification and standardization of data. The unification and standardization of data is very important to unify all the procedures of data collection, and to approach as much as possible the ante-mortem data collected in the countries of origin with the post-mortem data collected in the countries of destination and countries of transit. Post-mortem, ante-mortem data sharing between African countries, between Africa and Europe, and the protection of data challenges, collection of ante-mortem data in countries of origin and contact with the families, and put or develop a mechanism of support and ante-mortem data collection that correspond each context, taking into consideration the existence and the lack of different forensic and forensic medical discipline and experts, and ensure that this mechanism can be scientifically used in the identification process, taking into consideration the no-existence of some data in some context. So in some context, the existence of the advanced forensic medical discipline does not exist, such as forensic anthropology, forensic radiology, forensic odontology, the possibility to extract DNA and to ensure the DNA match. So we have to take into consideration those challenges in this aspect. Collection of ante-mortem data from the survivors, the role of the national society, the legal aspect, the acceptance of this data by other countries, collection of ante-mortem data in the countries of origin and contact with the families, legal aspect of each country, the protection of data challenges. Also, it's very important to include it in the legal aspect, and the identification issues. Actions. For the actions, first is the assessment and the evaluation of the context to understand the existing forensic medical and forensic procedures, and to understand the legal aspect of the forensic medicine, to identify the different responders, and to identify the level of cooperation and coordination between different responders. Reinforcement and building of the forensic and forensic medical capacities. So after the identification of different responders, the organization of sensitization courses, organization of training courses, cooperation with the training units or the training committees of different institutions to develop or create a technical and the practical training courses, cooperation with the universities to create and develop academic training courses to ensure the continuity of the activities in each context. Here also, we should take into consideration the safety and the protection of the responders, not only the physical safety and protection, but also the mental and psychological safety and protection, and to develop a mechanism to communicate with the families that also include a mental and psychological support. Central unification and standardization of data collection. So it's a coordination with relevant authorities and organization of roundtables and workshops to unify the procedures of data collection, to identify the role of each responder, to determine the level of cooperation and coordination between them, to develop a plan of action, a mass fatality plan, a management of the death plan, a contingency plan that correspond to each context, and to formalize the use of the developed procedures. Centralization of collected data. It's very important to centralize the collected data to ensure or to facilitate the sharing of data between the different countries and between the different responders and structures in the same country. And here also encourage the countries to develop a mechanism to share data and to share the collected data, and support the relevant authorities in the creation of centralized database to facilitate this process of data sharing. Contribute to the identification of the deceased with the best practices, and develop a mechanism of antemortem data collection that include the management of the needs of the families. So COVID-19 related activity, it's logistic, scientific and technical support in the development of COVID-19 management of the death procedures, cooperation and coordination with the forensic medical department and the relevant authorities, logistic, scientific and technical support in the development of COVID-19 management of the death training material, donation of protection and management of the death equipment, and supporting the national societies, the Red Cross and the Red Crescent involved in the management of the death in different contexts, as some of the national societies in the countries of West Africa was requested officially to be involved in the management of the COVID-19 related deaths. The activities in many contexts and in many countries. So in Niger, there's many activities in Tillabéri region, in Niamey region, in Agadez, in Difa region, and the organization of roundtable with relevant and concerned ministries involved in the management of the death, to create a management of the death committee to start the process of development of mass fatality plan, management of the death plan, and to put the level of coordination and cooperation between the different involved responders. So the creation of the management dead body management committee, organization of training and sensitization courses in different regions, development of a training course in cooperation with the training organization committee of the Nigerian Armed Forces, development of an academic curriculum in cooperation with the University of Niamey and the University Hospital Center, and close coordination and cooperation with the different relevant authorities, forensic doctors and the practitioners, and the National Society in the management of COVID-19 related deaths. Also, we support the organization of the African Society of Forensic Medicine, where a group of experts from the countries of West and North Africa participated, and we tried to create a working group that include, or that with all those experts from the countries of North and West Africa, to facilitate the dialogue, the discussion, and the exchange of information. So the creation of forensic working group for French-speaking West and North African countries that include experts from Tunisia, Morocco, Algeria, Senegal, Democratic Republic of Congo, Cameroon, Djibouti, Ivory Coast, Togo, Nigeria, Burkina Faso, Congo, Brazzaville, Guinea-Conakry, with regular discussions and dialogue and exchange of experience. In Morocco, in different regions, organization of training and sensitization courses, organization of roundtables to put a mechanism of management of non-identified migrant dead bodies, and the activities in Morocco, the unification and standardization of management of these procedures, organization of training and sensitization courses in different regions, development of training courses for the emergency responders, development of an academic curriculum in cooperation with the University of Marrakesh and the University Hospital Center, participation in the national and regional conferences and coordination with the different relevant authorities in the management of COVID-19 related deaths. In Mali, also organization of different sensitization and training courses in different regions. So organization of training and sensitization courses in different regions, development of a training course in cooperation with the training unit of the General Directorate of Civil Protection, and development of an academic curriculum in cooperation with the University of Bamako and the University Hospital Center. In Tunis, organization of roundtable to unify and standardize the different procedures related to the management of the death, and to clarify the framework and workflow of the management of the death from the legal and forensic and medical legal point of view. Also organization of training courses, especially advanced management of the death training course, in cooperation with the University of Niamey and in cooperation with the Forensic Medical Center in Switzerland, Lausanne and Geneva, and the Argentinian team of forensic anthropology. This is an advanced course with the participation of experts from different countries from North and West Africa, and this course provide training and practical sessions and theoretical sessions on the best practices of the management of the death, with many practical exercise, including the exhumation of dead bodies, including the examination of dead bodies, and many activities related to the mass fatality plan, death scene management, and this discussion on the reinforcement of different capacities in different countries. So in Tunisia, unification and standardization of management of the death procedures, organization of roundtable with the involved ministries and authorities, organization of training and sensitization course in different regions, development of an academic curriculum in cooperation with the University of Tunis and the University Hospital Center, development of a regional 3 weeks management of the death course, Arabic version and the French version in cooperation with French, Swiss universities and the Argentinian team of forensic anthropology, and with Arab universities for the Arab version. Participation in the organized conferences and the close coordination and cooperation with the different relevant authorities and forensic medical department, Ministry of Health, in the management of COVID-19 related deaths. So also there is many projects to reinforce the capacities of examination of dead bodies with the storage capacities, temporary and final and long-term storage capacities, rehabilitation of mortuaries, and reinforcement of storage capacities. This Excel table contains a short description of the activities in countries of West and North Africa. What are the kind of the activities provided in each context? And thank you for your attention.
Thank you, Dr. Bilal Sablouh. And now, healthcare professional fighting against COVID-19, work accidents, or professional disease. It will be presented by Mariam Bouchelta, doctor at Institute of Legal Medicine of Casablanca of Morocco.
Dear international forensic community, I'm glad to be with you today to talk about health professionals and COVID-19 infection. Can we take it as a work accident or an occupational disease? Firstly, health professionals are the first bulwark against the spread of the pandemic infection. On April 6, 3 Moroccan doctors died from the infection, and their families received condolence from the Ministry of Health. Contaminated health professionals are about 16 in our country. Otherwise, health at work is a fundamental right according to the 2011 Constitution in its 31st article. If we talk about legal history of safety and health at work in Morocco, it took its first legal basis from the 715 Tahrir of obligation and contracts, succeeded by the first specific legislation, the Tahrir of 1927. In 1943, occupational disease became recognized in our country, and in 1947, commuting accidents. In 2002, work accidents insurance became compulsory, and finally, in 2015, the current legislation brought a simpler and shorter procedure. So now, can we recognize the COVID-19 infection as a work accident or an occupational disease? To talk about work accidents, we have to distinguish simple work accidents, commuting accidents, work accidents due to intentional or inexcusable fault. Work accident is an accident from which an employee is a victim by defect or during the performance of his work, even if the accident results from a case of a force majeure. So we have some criteria to observe. First, to occur in the context of employees in professional activity, including break times. To be sudden and to cause a real physical or mental injury. Now for commuting accidents, it occurs to a worker during his journey of return or outward between work and main residence, or between work and his usual restaurant, etc. Now for intentional or inexcusable fault, according to the Moroccan Labor Code, if it is committed by the employer, it retains the right to request compensation for damage in accordance of its rules by the victim. But in the case that it is committed by the victim, it eliminates the right to compensation for damage. Now, what are the different modes of transmission of the virus? Airborne droplets disseminated by sneezing or coughing are the specific and the principal mode, with physical contact, of course. And there is other means that are still subject of discussion and study. Jurisprudence requires precise time and place and the presence of witnesses. But is this possible in the case of a 13 kilobase virus? Can we find some arguments in favor of professional origin? So let's see, first with non-compliance of government protection rules by the employer. It can be in favor of a professional origin. Second, the fact that the employee was in contact with one of his colleagues recognized as COVID positive. And of course, the limitation of non-professional activities that may be a source of contamination in isolation period. And finally, the fact that no one is COVID positive in the private circle of the employee. And for legal recognition of occupational disease, it has to be the direct consequence of the exposure of a worker to a physical, chemical, biological risk or a particular work conditions. We have 111 table of occupational disease fixed by the Ministerial Decree of January 2014. But in the case where the occupational disease is not found in one of those tables, what is the answer? There is a distinction between the private sector's employees and the public sector. For the private sector employees, Cassation Court decided that the table of occupational disease is not an exhaustive list and it can be extended to other jobs. Now for public employees, the Public Service Code talks about illness contracted at work. But finally, Health Council is the one who decides after an investigation and its professional nature. And for both public or private sector employees, the expertise is one of the options. According to the Code of Civil Procedure, the judge may either, at the request of one of the parties, or systematically order an expertise or any other investigative measure of instruction. Now we have to make distinction between advantages of occupational disease and work accident. In work accidents, the remuneration is possible from the first day of sick leave, and there is no need for a contribution period. And there is a slightly less complicated administrative procedure comparing to occupational disease. So to conclude, recognition of coronavirus infection as a work accident or an occupational disease in our country is still non-official. But logically, we have to distinguish according to the high-risk work sectors. The medical sector may be on the top of the list, in addition to other essential activities. And the simplification of administrative procedures may help us to fight against the underreporting of work accidents and occupational diseases experienced in our country. And thank you for your attention.
Thank you, Dr. Bouchalta. And now the communication is entitled ICRC COVID-19 General Guidance for the Management of the Day's Rapid Distance Learning Tools Development, which it will be presented by Dr. Neil Morris, a forensic specialist for Anglophone Africa, International Committee of the Red Cross South Africa.
Good afternoon. Welcome to Neil Morris's presentation on the ICRC COVID-19 General Guidance for the Management of the Dead, a rapid distance learning tool development. The outline for the presentation is very briefly to discuss the ICRC forensic strategy, the Forensic Strategy for Africa, COVID-19 guidance, the COVID-19 training tool that is being developed. First of all, to introduce myself, my name is Neil Morris. I'm a forensic specialist for Anglophone Africa, and I have been tasked with developing the distance learning tool for the COVID-19 guidelines. If you would like to contact me at any stage, please contact me on nmorris@icrc.org. I often get the question of what the difference is between the Red Cross, the Red Crescent, and the national societies and the Federation. I like to think of it as a family, and within each family, everybody has their own skill set. And within the forensic service, the ICRC supports the Federation and the national societies with their mandate and positioning themselves and with guidance on forensic matters and issues, and we support each other through the process. The ICRC strategy, in summary, is preventing and alleviating the suffering of people affected by conflict and violence, and in delivering relevant and sustainable humanitarian impact. The strategy outlines a proactive response to the challenges and opportunities the ICRC is likely to encounter, and is to inspire staff and donors and other stakeholders. So, where does forensics come into it? Well, the objectives of forensic service within the ICRC is to promote the proper and dignified management of dead bodies, to provide practical recommendations for non-specialists, including the collection of basic information, to maximize identification of recovered dead bodies, and to minimize the suffering of the bereaved families. In short, it is implementing simple and effective measures early in the process to significantly improve the opportunity of successful identification and the families knowing the fate of their loved ones. The ICRC Forensic Service specifically works in three main areas: armed conflict, catastrophes, and migration. In terms of catastrophes, emergencies as well. What does the ICRC Forensic Service promote? The ICRC Forensic Service promotes forensic identification of bodies, robust and sustainable systems, proper dignified handling of the dead, and this ultimately breeds respect for the living and the family's rights. The African Forensic Strategy has 7 priorities. First, acceptance and positioning of the ICRC, to contribute to the ICRC's multidisciplinary response to missing persons, management of the dead in conflict, other situations of violence, and migration and emergencies, to actively respond to other humanitarian challenges, streamline forensic programs throughout the region, efficient and effective partnering for assisting affected populations, and to contribute to the institutional human capital. So, the ICRC Forensics team devised the COVID-19 General Guidance for the Management of the Dead through the ICRC Forensics Unit. This was a collaborative guidance note that was based on scientific best practice and grew and developed into a multitude of assistive publications, posters, and guidance notes. This was all built on the Management of the Dead course that the ICRC has been promoting for first responders and the management of dead bodies after a disaster. The COVID guidelines are seen as an additional chapter and annex to streamline and to assist in first responders safely responding to the management of the dead in a COVID-19 crisis. And it is built on top of this manual for the management of the dead. It changed and our method of working needed to change with a large number of travel restrictions that have occurred across the world and across the African continent. There are only 5 forensic specialists for the African continent, and our travel restrictions were implemented quite early, so we couldn't reach the affected populations as effectively as we wished. So we needed to change our strategy. We needed to change our strategy because we have all these tools and forms and guidance notes that can reach and assist affected populations. So the question was, how do we still train people when we are not allowed to be there? First of all, we decided we needed to distribute the guidelines. First of all, through communications at conferences such as this one, social media, through our alumni network of everybody we have already trained to provide an understanding of the settings, do assessments of each of the continent systems, and the preparedness plans for each of the organizations that would request it or government agencies that we can assist, and to develop further and share this information on a sustainable network of support, such as the LinkedIn platform. A need was identified for a training tool. This training tool would be used by forensic specialists when they were unable to travel. It was seen as a forensics team multiplier. It needed to address and highlight the most important aspects of the COVID-19 guidelines. It needed to be technically accurate and culturally appropriate. The aims and objectives were that it was an animation, that there was a neutral, understandable voiceover. It was identified that it needed to be rolled out in 2 phases. One, specifically, quickly for the COVID-19 guidelines, and the second as a refresher for the management of the dead in disasters. It was also identified that we were in need of a professional company who would assist us in rapidly deploying the training tool and with an understanding of an African-centric theme that needed to be part of the development of the tool. Also, it was understood by the team that in developing this tool, it was not a replacement for hands-on face-to-face management of the dead training, but as a last resort or as a refresher tool. The results in the first phase were the storyboard associated with COVID-19. And here I have cut a few images just to demonstrate what the development process looked like. First of all, there was an introductory section on what COVID-19 was and what the guidelines were. The second area is on how to handle bodies and COVID-19 and how the protocol changes and what are the considerations. Next, there's a discussion about personal protective equipment and what personal safety needs to be done to ensure your team's safety, what precautions and considerations need to be taken into account when dealing with a COVID case, and the community and the dignity of the dead and how that can be maintained throughout the process. The storyboard also seeks to remind the responder that this is not the only part of the training, but that they need to refer back to the guidelines and the guidance notes, and that this is only an addition to the ICRC management of the dead in training and the manual on disasters. It was also a challenge to allocate an animation style that would be culturally appropriate through the African settings, and we feel we managed to achieve this. And here I demonstrate a few of the scenes that have already been populated. It was also very important for us to specifically nail down the technical accuracy of the equipment and the environment for the telling of the story and the animation. In conclusion, the development of this video is 2 weeks from completion. It is in rapid development, and we have already scheduled 2 trial training dates. I would like to first of all give a word of thanks to the Africa team of ICRC for the development of this video, the Blink Tower team, the professional company that has built and led us through this process, the forensics unit within the ICRC, and the Pretoria delegation where I am based for allowing me the freedom to do this. Please consider joining the LinkedIn group. Here is my QR code, or just search for me, Neil Morris, and I will then invite you to join the Africa Forensics community, and we will then share updates on this platform with you surrounding the development of this training tool. Thank you very much. I'm excited in the development of this tool, and I will be very happy to share it with you once it is complete.
Thanks for all speakers, and now I give you an appointment for the second session with the French languages at 16 GMT, more 1 hour.